Hi everyone, welcome to my next YouTube video. So today I just kind of wanted to go over some things I learned at a class I recently attended. So you should know, I'm a first-time mom, so there's a lot of things I still am trying to figure out, and I recently went to a class at one of our local kind of maternity mommy stores. It's got a lot of different baby items, but they also have cloth diapers, which I like and is how I found the place, but they also sell maternity clothes there. They do maternity consignment, so it's a nice resource for some cheaper maternity clothes. But they also have a whole section in the back where they do different classes every week, and I kept meaning to look into this and never really kind of got it together in time to see what the classes were. But they have a few classes that meet throughout the month and regularly, and then they have on Mondays they bring in different talks every week. So this week was actually on postpartum care, and I expected it to be both baby and mom, and it did focus a little bit more on baby and what they do immediately after, which was fine, and I still learned a lot of useful information. So I'm by no means an expert on any of this, but I wanted to kind of share what I learned at this class. So the first thing I learned is the first thing they're going to do within the first pretty much 1 minute after birth, and then 5 minutes later, they're going to do an APGAR score on your baby, which basically measures heart rate, their respiration rate, different reflexes, muscle tone, and color. And it can be done while the baby's lying on the mother, so if you want skin-to-skin contact immediately after birth, that won't be an issue to affect this test. But that's kind of what they're going to be doing immediately. And the baby will be bluish when it's born. And I did learn what I didn't know is that the hands and feet can actually remain kind of bluish in color for a couple days, but as long as their head and torso region are all a healthy pink, it's not as much of a concern. The woman who was teaching this class was a nurse. She said she's had countless mothers who were kind of breastfeeding the baby but not really doing a lot of changes or putting on a lot of the clothes because they're still recovering. So they hadn't seen like a full check of everything, and then when they go to change their baby into their going home outfit, they see their hands or feet are slightly blue and get all freaked out. But that's normal. Different things that they do to the baby is kind of what we covered. So one of them is they put in eye prophylaxis or antibiotic ointment, and this is drops that go into the baby's eyes, and it actually prevents potential blindness or a serious eye infection due to some sexually transmitted diseases. So this is something you can refuse. If you are absolutely sure you have none of these diseases, usually it's chlamydia or gonorrhea in the mother can affect their eyes, then you don't have to get this ointment. But you need to be absolutely sure, because if you do have any of these infections, it can have serious effects on your baby. But this is something that just kind of became standard practice, so it's something they do unless you request otherwise. Another thing is the vitamin K shot. It's essential for blood clotting, and newborns don't have a lot of vitamin K in their system at birth. So it's something that's routinely given. It does help prevent against a serious condition called hemorrhagic disease. Sorry, I'm looking at my notes a lot, but that can affect a newborn. It's rare, so it's unlikely, but could happen. You can also be requested that the vitamin K be given orally if you don't want your baby getting a shot immediately after birth. This is, again, something that you can choose not to have done, but just do your research and understand why they do these items is important. If you do have a baby boy and you are getting him circumcised, you will not have a choice on this. You have to get this shot done. Just because, to help, because he's going to be having an open wound right after. So that's something that will be done. They will also check by their blood sugar volume by pricking on the heel, and they'll check it when they're under 5 pounds or over 9 pounds at birth, or if the mother is diabetic. Or if the baby is exhibiting signs of low blood pressure. So that's something that you can be aware of. It's also, if they do have low blood pressure, it will help with early and frequent breastfeeding for them. And then they do typical metabolic screens. They do something called testing for PKU and congenital hypothyroidism. I'm not going to get into details on that because I don't know enough about what each of those are, but make sure you're talking to your doctor about what kind of testing is done and what you would like done. And the last thing is a hepatitis B vaccine. This is optional, and it doesn't need to be given right at birth. Now, this was started common practice many years ago when hepatitis B was very common, but it is something that's only transmitted through dirty needles, blood contact, or a sexually transmitted disease. So it's not really necessarily a big concern in newborn infants nowadays unless mom has it. So it's kind of one of those things where you should do your research on it and decide, is this something I really want to do? If you aren't overly concerned about it, then you don't need to get it done. But it's also one of those things they just kind of do commonly. So if you want to just let them do everything they normally do in the hospital, it's not going to hurt your baby, besides, them getting a shot. So kind of look at pros and cons and figure out what's best for you and your children. And I believe it is something that will need to be given, again, if you choose to get it. They'll have to get boosters on it. So something to be aware about. And that's kind of most of what we went over. Another thing we talked about briefly was delaying the bath for your child. When the baby comes out, it's going to be covered in vernix caseosa, which is kind of like, they call it like a cheesy white substance. And this is what protects their skin in the womb from the amniotic fluid. So it's like if you were in a bathtub for an extended period of time, you get all pruny. So this kind of helps protect their skin from that. But if the baby's bathed immediately, it gets all this off, and there's a lot of research saying that this is actually really good for the baby. And they say that you should actually let it stay on and kind of soak up into the baby's skin. So if you delay the bath, you want them dried off because you don't want them to get cold. But if you delay the bath, you can kind of rub in the substance kind of like a lotion, and it actually will help moisturize, but also help boost up your baby's immune system. So that's something to consider. Again, if you're not comfortable with it, it's not like a necessity, but it's something to keep in mind, that you can request that they delay the baby's bath and kind of help rub this substance into their skin. Another thing to consider is delayed cord clamping. And when a baby's born, it's actually only born with about 2/3 of their blood volume. The rest of it's in the placenta. So there's argument on delaying the clamping of the umbilical cord until it stops pulsating. And what that does is it brings the rest of that blood volume from the placenta to the baby. So that's kind of something to consider. It's something most hospitals will agree to readily, to delay the cord clamping, and it only takes about 5 minutes maybe, so it's not very long, but it's just something to keep as an option. You can also look into, on the other side of it, is cord blood banking, where you actually take some of the blood from the umbilical cord and you bank it in case your baby has issues later on in life. Again, I'm not going to go into full detail on that because I feel like I don't know enough about it, but it's another kind of option out there, so that's something to consider as well. I have not decided yet about the delayed cord clamping. I feel like I'm leaning towards it, but I want to do more research on it first. So that was kind of it. I just kind of wanted to briefly go all over kind of things I learned about. Another thing to keep in mind is your postpartum care. I've had so many people tell me that if you're breastfeeding, your nipples are going to be sore and it's going to hurt, and they could even be cracked or bleeding. But what I've been told by medical professionals is if it comes to that, then you're not breastfeeding correctly, and get help. I know my hospital has lactation consultants that can come in and kind of go over things with you. But you can buy nipple cream, you can buy pads to help soothe it. I was also told that most of that is really unnecessary because if you're doing it properly, you shouldn't need it. But I probably will invest in something about some type of cream. I've also heard coconut oil can be really good for your skin. But I did also learn at this class that the best thing for your nipple is to actually put your own breast milk on it and let it air dry, and that will actually help keep them moisturized, which is kind of interesting and not something I would have thought of. There's also, if you look it up on the internet, there are myriad sources of things that breast milk is good for. So it's kind of interesting to see all the things they say that breast milk is good for, but something to keep in mind, rolling around in the back of your head. That's something you can definitely look up. And then another thing you're going to have to decide for baby is circumcision if you're having a boy. There's a lot, it's a very hot button topic, but more people are leaning towards not doing it because there's really no medical necessary reason to have it done. There's nothing that says that it's better one way or another. So a lot of people are saying, well, if it's not really necessary, I don't want to put my son through that. But again, in the United States, it's more of a social norm nowadays. But it's very common to not circumcise in other countries. So it's kind of something that's very personal you have to think about for yourself and what's right for your family. But definitely something you need to keep in mind that that's something you want to research if you know you're expecting a boy. Another thing for yourself is that you are going to essentially have your period for up to 6 weeks after birth. Some people it can be less and you'll only bleed for about 2 weeks, but some people up to 6. So it's very, very person to person. And I knew that you were going to bleed. I didn't know it could be that long. So it's definitely was good for me to learn. And you're going to want to be prepared and have pads because you cannot use tampons. And the hospital typically provides you with some ice packs, or you can also get like witch hazel pads, which are supposed to be very soothing and cooling. And they will give you those things in the hospital, but otherwise you can also pick up those witch hazel pads on your own, or get your own ice pack. So something to keep in mind again for yourself, and just basically to be prepared to be very tired that first week. You're not going to be wanting to do a lot. You're not going to be running around cleaning. Pretty much you're going to be sleeping and feeding the baby. And if you have people who are willing to help, give them something to do. A lot of people will just say, oh, let me know if you need anything. Well, you're not going to be thinking about all the things you need during that first week. You're going to just be thinking about how tired you are and is your baby okay. So it's much better, really it's better if a person asks you, what can I do for you now? Can I bring you food on this day? But if you need to ahead of time, say, hey, could you get a couple dinners ready for me, or stuff you can freeze? Could you come over, every other day and help me clean my kitchen? Little things like that. You want to kind of have those set up so you're not having to think about it during that first time after when you bring baby home. Also, a lot of people will do freezer meals, so make a big batch of soup and freeze a bunch of it so you're not having to cook dinner while you're working on with the baby. Hopefully you will have someone at home to help you, but if you don't, keep these things in mind and try to prep for it ahead of time. You're going to be really tired those first couple weeks, and look into resources to help. I know my hospital, again, offers classes every week on different things, and you can go in and talk to a lactation consultant at this time if you're having trouble with breastfeeding, and places you can call if you just have questions. So all these are really important to know ahead of time so you're not getting into there and then not really knowing what you're going to do when you go home. So that's kind of everything I have today. I apologize that this video is late. We spent a lot of time working really hard in our nursery. So as you can see, I've changed locations. This is actually Tobias's room, and we'll do a full nursery tour when it's complete. But you can kind of see we finished all our painting on the walls, and we got our curtains in place. We started getting furniture in place. So we have a little bit more to do as far as just decorating the walls and things like that. And we're probably going to get a few more small items of furniture. But I'm really excited about it. It was a huge feat to finally get it done. We've been working in here for about a month and a half. Really, my husband's working in here. I helped with the smaller painting, the trim work, and all the details. So it was really exciting to finish. But that is why I did not get my video out on time. And from now on, I'm hopefully going to be doing these videos in here. And when it's all completed, I'll do a full nursery tour. So thanks guys for coming out, and I'll be getting my video for my update posted within the next day or so. So thank you.